Good morning once again from Dubai back to Nairobi and the launch of HealthX in Kenya. I will quote once again what Kaiser Manji, the CEO of HealthX, said, "A doctor for every Kenyan. Not a dream, I believe a reality, but maybe we still need to convince you," which is why I'm joined by a panel of experts. I'm already sold, and maybe are you, but there are naysayers among us. That's the reason why I have the following people with me. I have Onesmus Mwaura Kamau. He's Director, Health Informatics and Digital Medicine. I did not know this existed. I'm going to be very honest. And this is a department in the Ministry of Health. He's a biomedical informatics specialist who is passionate about information, technology, health IT, public health, and law. And because the sort of thing we're doing must be communicated, Engineer Daniel Obam, who told me it's been too long, indeed, COVID has made sure that we cannot see each other. He's a communications secretary, the National Communications Secretariat in the Ministry of Information, my ministry, my regulator. And the Secretariat advises the government on communication policy matters. And Engineer is an expert in policy, regulatory, operation aspects of ICT, especially telecommunications and broadcasting. And I have a time traveler with me, of sorts. And this is Dr. Raouf Khalil, a PhD. He's founder and the chief executive officer of TruDoc that I mentioned earlier. He's a lifelong innovator and entrepreneur. He's committed to bringing quality healthcare as close to every patient as possible. Hence, the dream of a doctor for every Kenyan is true. Dr. Khalil has founded and served as chairman and CEO of multiple healthcare companies across the US and the UAE. And as we speak, TruDoc, which is a 24-hour, 7 days a week service, serves over 4.4 million paid subscribers and 6,700 multinational corporate clients. Yes, HealthX is available to corporates as well, but we'll get into that. And finally, a person I've gotten to know and giggle and laugh with. She makes medicine fun. And this is Dr. Radha Karnad, and she is the Chief Medical Officer at HealthX Africa. She has over a decade of experience developing innovative approaches to quality clinical medicine and healthcare program management in the UK and in Kenya. She's driven by the genuine belief that health should be a right for all and not a privilege of a few who can afford it, indeed. And Dr. Karnad's work seeks to improve health systems to solve persistent global public health problems and improve access to health for all. And she says that she too calls the doctor too often when her babies were younger. So she's just like you and me. However, I'm going to start with the health informatics. Is there truly a confluence between medicine and technology, not equipment, but in this manner? And the reason I'm saying that is that, once again, we are Kenyans. I'll start with us. Lazima nione daktari, nidungwe, anishike hapa, anifinye kidogo, ndio nijue I've seen a doctor. What do we do? Is there a confluence there?
I think if we look at the statistics about Kenya, you see that we have about 50 million Kenyans. And you have talked about 70% of the population being in the rural setup. If you look at that scenario and look at the distribution of our facilities, the geographical coverage, and then looking at the need, the unmet needs of the Kenyans in terms of the health needs, you see that Kenyans have a long time been having challenges in terms of the access and affordability of quality healthcare. Talking about how technology can be able to improve, or rather to be able to change the scenario, first and foremost, I'd like to say that telemedicine in Kenya has actually been at the infancy stages. We have not been having projects in telemedicine. People have been talking about technology, but they have not been able to really come up with robust innovations that can be able to make service delivery easy and maybe also to improve the quality of care. So looking at the scenario that you have seen from the UAE, you see that the population of Kenya, despite the fact that they have the capability to actually seek care where they are sick, the issue about the access has actually been a challenge. Talk about the UHC. We are talking about how can we be able to revolutionize, how people can be able to get that access from that rural level, from the ground level, from the population level, so that they can actually be able to receive the quality care that they are looking for. So for me, I would like to say that I see a lot of potential in terms of using technology And I see a lot of potential in terms of leveraging on proven technologies to make sure that Kenyans can be able to access the quality healthcare. And in this it comes with it a lot of benefit in terms of the accessibility, in terms of the cost, in terms of the geographical coverage. You see that someone who is actually in a remote area like Mandera, or in this other area like maybe Kajiado or Wajir, who have actually been disadvantaged because of the infrastructures and all that, they can actually be able to access quality care. They can also be able to access experts. And I think talking about the distribution of a health workforce, I think that's an area that I want to talk about. Most of the health workforce is actually concentrated in the urban centers. Before devolution, you see that most of the experts, they are actually in the major urban centers that you know in Kenya, meaning that people who are actually in the community level, they had to travel for long distances. They could actually not be able to access the quality service. They could not be able to access, experts. Even when they access them, the cost was actually too high. So really, talking about health informatics and technology is a way to go, and that's what we can be able to leverage on to make sure that our population can be able to access care, and also when they need it.
The dream is a doctor for every Kenyan. Dr. Karnad, I need to come to you because we also have an issue about seeing the doctor. And when I say we, I will classify this. Men don't see a doctor unless they have to, first and foremost. But then young women, young men, it's not just the issue of cost. And cost for me, I understand, is time. Because a young person is always thinking, do I want to be in a waiting room for an hour and then see a doctor? But there's also stigma, there's fear. What are the things that keep us away from the doctor?
Thanks, Caroline. I think that that is the question we're trying to answer here at HealthX, because there are multiple factors, as you've said, cost being one of them, experience of care in the past. If you've been to a doctor or had a very negative experience waiting an hour and a half, a 7-8 minute consultation, you come out, you pay your 4,000 shilling bill. Those sorts of experiences can be quite off-putting, as well as, of course, the need for privacy. So depending on who we're talking about and where, the doctor you may be seeing or the nurse you may be seeing, maybe somebody from your own community, maybe your aunt, maybe your uncle, right? So then how does that fit into your own sense of privacy and need for your own confidentiality? So there are multiple challenges like that. Of course, access just in terms of geographical access, the cost of travel, childcare, all of those things, taking time off work, all of those things also factor in. So I think it's a real, there's a whole system of challenges that we face or that we weigh up every time we say, am I going to the doctor today or not?
Yes,
and that's even more, that's challenging enough when you're sick. But when you're well, when we're talking about preventive care, when we're talking about promotive care, things like that, when you look at the world of challenges and this idea of I can go and try and improve my healthcare today so I don't get diabetes or hypertension 5, 10, 20 years down the line, those things don't always weigh up. So I think what we're trying to do at HealthX is take away some of those challenges, make it really easy for you to make the decision to call your doctor today. And yes. That is cost stops being as much of a challenge. Access, you call us when you want. If you want it to be at 3 o'clock in the morning, we can do that. If you want it to be when you're at the bus stop, we can do that.
True.
So we want it to be on your lunch break. All of those things, we're trying to make it possible for you to really access healthcare when you want without having to wait, without having to worry about it. And then you feel, yes, it doesn't have to be when I'm sick. I can call you when I feel perfectly well and I want to stay this way. I can call you now and you'll help me figure out that journey. True. So yeah, that's what we're hoping to do.
There's a lot that excites me about HealthX, but like I said, this is not my conversation, which means I'm coming to you, and not to put you on the spot. Why don't we go to the doctor? Before we even talk about the fact that finally with HealthX, you could actually be sitting in traffic and you can dial your doctor. You can put on your headset, pigia daktari, have a conversation so that you don't literally have to be stuck. And until, the roads in Nairobi are clear, because we don't know when Chinese atafunga mahali. Why is it first and foremost we don't go as often as we should go?
Yeah, the process of seeing a doctor, somebody of my age, normally you had to prepare. Because probably it's 10 kilometers away, 20 kilometers away.
Okay.
There's no bus, perhaps you'll have to walk. And then when you go there, you find about 50 people waiting. Mm-hmm. So you really go to see a doctor when you have to, when you have no option.
Okay.
And of course, I'm here not talk about why you don't see a doctor.
Yes. Yes.
As the Ministry of ICT,
Tell me.
Innovation and Youth Affairs, not by Ministry of Information.
Wait.
Our role is to provide, Daktari said you call, but how do you call? How do you connect to the doctor? So we provide that backbone, the arteries that make sure that you can reach the doctor.
Yes.
And so what we are doing is the ministry is putting in place and actually investing money in putting in place a national fiber backbone that will ensure that you can connect the Kenyans to a doctor, the health facilities can be connected, you can share resources. When I was young in the university, whenever you wanted to see a doctor, you carried a brown envelope that contained your x-rays, your notes from the doctor. But what we are putting in place allows you to digitize this, and then you can go to any doctor and they can be able to call up your records.
True.
So what we've done so far, we've managed to connect all the counties with what we are calling the national optic fiber backbone infrastructure. The next phase is to connect that network to the sub-counties.
Okay.
That means if I'm in a sub-county, I come from Busia, called Nambale, I can actually call the doctor and even share images with her when she's in this building.
That
so
is
I don't
brilliant.
need to travel by bus overnight.
Carrying your brown envelope.
Brown envelope to come here to see the doctor. So this is what we are doing. But this confluence is not just now. And if you allow me, I want to go to one of my previous lives, where also you are one of your previous lives. About 20 years ago, we were promoting a radio, which you could walk around with.
Yes, I remember that.
And one of the things we did then, that radio could also download data. So there's a magazine, I forget the name, that doctors used to subscribe to. So it was sent by post. So of course it would disappear from the post office and then it's sold to you on Uhuru Highway. So what we did, it was a British magazine, it was digitized. So as soon as it's released, we got it, downloaded it, and we connected that device to your computer, and you could read it immediately instead of waiting to buy your own magazine on Uhuru Highway. So the confluence between technology and medicine, has been there. Now we've seen how mobile technology, especially mobile technology, has improved on financial inclusion, getting government services. I don't want to tell you how I got my first passport, IDs, driving licenses, paying taxes. So healthcare is just one of those services that can also leverage on these platforms that ICT provides.
Yes.
And I think that it's just a natural evolution in terms of providing healthcare and trying to provide this a doctor for every Kenyan.
Yes.
In conclusion, if you look at the Sustainable Development Goal number 3, which is well-being, good living and well-being. And also one of our big 4 agenda items, which is universal healthcare. You can only achieve this if you leverage on technology.
True.
And that's the role that the ministry is playing in this. So as we are just providing those arteries, whatever flows in the arteries, we leave that to the doctors and other people to use, but we provide that connectivity. Thank you.
I must say, I love the way you've used your medical technology and terminology to be able to explain this. Arteries, my friends. So, if you're just joining us, today is the launch of HealthX in Kenya. Our hashtag is HealthX Launch, and the dream and the vision is a doctor for every Kenyan. I introduced him as my time traveler. And the reason I've done that is that because Raouf has already traveled the journey that we're embarking on, and this he has done in the US and in Dubai as well. And I guess what I need to know from you is this. What do you know today that we ought to appreciate, even as we grapple with the idea, and the very Herculean idea that Kaiser put forward, a doctor for every Kenyan? It sounds rather ambitious. But when you think about it, with technology, that's actually not impossible. And it's important that even as I ask him that question, you understand that the future is already here. It's just not evenly distributed. So you've been to the future. Welcome to the present. But tell us, what does it look like over there?
Well, thanks for having me. I've been called a lot of things before, but never a time traveler.
Oh.
So that's a new one. In any event, my journey started in 1989 in California, first company I founded. I've learned through the whole journey that people complicate healthcare much more than it should be. You look at the three stakeholders. We have patients, payers, and providers. Each one of those are conflicted with the other. So what we try to do is to give each one of those what they want. We want to give the patient a concierge service, have a doctor in their pocket 24/7 when they need a doctor. We want to make sure that the payer is okay by actually saving them money by providing that concierge service. And we want to be able to get the provider, the doctor, a chance to be able to tell the patients the truth about what they need, not what they can afford. So if we can give each one of these stakeholders what they want, we will align them, and healthcare will be much simpler. So right now, when I go to different countries, I see one thing. I see Albert Einstein's definition of insanity. Doing the same thing, expecting a different result. So it's as simple as that. We got to give every stakeholder what they want, which I believe HealthX is doing. And we want to be able to access it. When they need a doctor, they are entitled to speak to a doctor. So we want to put a doctor in your pocket. The other vision that we have here in Kenya is to be able to put a virtual clinic in every village. A virtual clinic, we've done it in Nigeria. So we put a virtual clinic next to a primary care center. Kenyan will have, they have an option. They can wait for 7 hours to see a doctor in the clinic, or go and walk into our virtual clinic next to it. For 2 minutes, you have a video call with our doctor, the issue is resolved. It's all about changing people's behavior, and we need to make sure that they know we're aware that we're here, so they have a better option. Hospitals should only be for emergencies and operations, nothing else. And no one can afford to build hospitals anymore. So technology allows us to satisfy all these three stakeholders. And that's really the most I've learned in my journey through 1989 is actually doing home visits, because it's very pure. You have a patient and a doctor at the home.
Yes.
And you learn exactly what the patient wants and what the doctor wants. They want the same thing: quality care and cost effectiveness. Unfortunately, through the journey of healthcare, there is too much incentives to be able to have a profit-based medicine rather than evidence-based medicine.
True.
And this is what our full-time doctor experience with them. So anytime you call them, they will tell you the truth about what you need, not what you can afford.
I wrote that down the minute you said it, and I hope you tweeted that as well, because what HealthX, TruDoc, fixes is just that, making sure you get what you actually need, not what you can afford. He said that, and my brain swung to you immediately, because you're just not the chief medical officer here at HealthX, but you're a practicing doctor. Is that true, that by and large, because of the cost of medicine, most of the time you end up giving a patient what they can afford as opposed to what they truly need? Just help me unpack that.
Yeah, I think that that is a constant challenge that doctors face across the globe, in Kenya as well. You balancing out what patients can afford, and that's on two sides. Sometimes we see people being overtreated,
yes,
because their insurance is covering it, or because it's clear that they can afford it, and so they go off and get a bunch of, or because they're demanding it. Sometimes Dr. Google or wherever else, a multitude of reasons that people may have way more tests or insist on treatments. Like I've come to see the doctor, I don't want to leave without my antibiotic prescription, whether or not it might be viral and I actually don't need it.
Yes.
So that's one side of it, I think, where very often, we're seeing a lot of additional expense that's not necessarily clinically warranted. Or on the flip side, patients who genuinely need services but aren't able to afford it, and so you're trying to give them the best of whatever the options are to them.
What they've got.
It's very, very, I think it tends to swing on both sides. And as doctors, I think what digital health offers is an incredible privilege to be able to spend more time with your patients without having to worry about the cost of that to them. Instead of a 7 or 8 minute consultation, you can spend 20 minutes to understand the breadth of the challenges they face, because healthcare is just one piece. Your social setting, your financial setting, all of that factors into your health all the time. And doctors don't necessarily have the time to understand that and make a healthcare plan with you that pulls all of that in. So I think, being able to understand that and understand where you're coming from and being able to say, give it 12 hours and I'll call you back as the doctor. You don't even have to call me.
Okay.
And if you're still not well, we make the plan for what's next. You don't need your antibiotic starting now. Let's wait and see how this goes. Technology and digital health and platforms like HealthX allow us to do that. And I think that benefits the health system more broadly and the doctor and the patient.
Okay, I love that. And I hope this is becoming clearer and clearer to all of us that, when Kaiser Manji said a doctor for every Kenyan, it was like, okay, that's large. And all of a sudden you realize this is true. And I guess I need to ask the informatics person. I just love your title. Does this excite you, or are you sitting here saying, what has taken us so long? Do you feel that our time has come?
Thank you very much, Kara. I think just what the other speakers have talked about. I think time is right for us to embrace technology so that we can be able to leverage on the power of the different innovations that we have within the country and also globally. Technology is actually the fabric that actually brings us together in terms of the accessibility, affordability, and even issues around the quality of care. Because at the comfort of your office, you can actually be able to access the best expert. You don't have really to move. In terms of affordability, I think geographical issues that we raised earlier can actually be addressed by looking at how you can actually be able to reach out to the experts. Without necessarily, in fact, if you look at the current scenario in Kenya, someone will leave the office at 9 going to the hospital, and they want to be back maybe by 2 or may not even come back. So you can be able to embrace technology. You can actually be able to even improve the productivity of our workforce. So those are some of the issues that we see as low-hanging fruits that can actually be able to leverage on as a country, and in making sure that we don't really lose this good opportunity that's coming, with the new technology that's coming around.
I got you.
Yes.
Engineer,
Yes.
when somebody tells you, nilikuona na Karo, mulikuwa mnasema nini, what is HealthX? What do you say to a person who doesn't understand the technology, the medicine, who's not from the future? Why should they get behind HealthX? Because, Kaiser, I need to know, have we told anybody how much this is? At the very least, it's less than 500. Less than 500 a month to subscribe, to have a doctor on call. Concierge medicine, but available to all of us. What do you tell them? Tulikuwa tunafanya nini hapa?
Yeah, of course, I will not talk about a specific product.
No, please don't.
But
Uh-huh.
what we are discussing, and if COVID has taught us anything, is that we can actually leverage on the investments that we've been making sort of slowly in the past, and now that we are accelerating investment in, to actually solve some of the problems that have been with us. So tulikuwa tunaongea mambo ya how we can use technology to provide universal healthcare or healthcare and have faster turnaround times than was there before.
True.
So just the way we can send money using M-Pesa, or you can apply for your ID or from your mobile phone, we are discussing how we can try and do the equivalent of M-Pesa
Yes.
with healthcare.
There you go.
And therefore, this could just be maybe one of those products, just the way you can transfer money from your account,
Yes.
using your phone.
True.
Or you can send money to your grandmother or your mother, or you can pay school fees, or you can pay for electricity. So we are this. I think we are looking at other aspects of leveraging on ICT to improve the livelihood of Kenyans. Thank you.
Okay, so my tram traveler, Raouf, I will finish with you. And my question is, where do we go from here? And let me set this up for you. I'm one of those people who believes that bank is something we do, not a place we go to. because we do it on our phones now. Shopping is also something we do on our phones. Goodness knows, if we don't have to go to a restaurant, we don't. We order in, even in Nairobi and in Kenya. So what does TruDoc, HealthX, mean for medicine? Where do we go to from here?
I believe that we have to give people two choices. Right now, for example, in UAE or other countries, you have a phone number, 999. You don't feel well at 11 o'clock, so you call 999.
Okay.
90% of these calls are non-emergency.
Okay.
So you're calling an emergency line and you don't have it, but we don't give an alternative.
Okay.
The alternative should be 111. You
Okay.
call HealthX first when it's not a life-threatening condition. Then we'll do the appropriate triage.
Okay.
We cannot leave it up to the citizen or the individual to decide whether this is emergent or urgent.
Okay.
They're not physicians. But we have to we're obliged to give them the opportunity to find out which one it is so it will end up in the appropriate level of care. Otherwise, they're going to end up being in an emergency room.
Okay.
That's why the emergency room are so packed. And the hospital are so packed. And nobody wants to be in the hospital now for obvious reasons, COVID.
Yeah.
We had a great hospice program in Beverly Hills in California, in the most expensive hospital in the world, Cedars-Sinai Hospital. We had doctors doing ground visits, and they tell the patient, hey, you can stay another week in the hospital, but we can send you home to our hospital at home program and monitor you at home as if you're sitting in the hospital.
Okay.
Right. So this is all about giving people what they need, which is the appropriate level of care. Otherwise, there's no more money. We spend $3 trillion a year in the US. We fail to align the patient and the payer. This is why we have to use technology and be able to get people what they want. Otherwise, we're not going to change the behavior. They're going to end up in the emergency room. So this should be the future of healthcare, is helping people determine what's the appropriate level of care through offering them a doctor in their pocket 24/7 when they need it, not when the doctor is available.
Awesome. I really like that. So that is the future. I am going to end this session, and just because I think the conversation and the questions are important, but I think you want to see it. And the beautiful thing about this morning, HealthX has actually given us an opportunity through the camera for you to actually see what HealthX is about. I know I have been selected as the guinea pig who will actually have a virtual consultation, which is not a problem because if you're going to believe it, at least it must be me, it can't be the doctor. All I want to leave you with is this, that when Kaiser Manji spoke at the beginning of this conversation, he did say a doctor for every Kenyan. And I think it's very important to keep that at the back of your head. But maybe what you really need to be thinking is a doctor for me. Every Kenyan is great. There's too many of them. But finally, from the comfort of the matatu, sitting in traffic, your home, sadly some of you take calls in the bathroom, go right ahead, you can finally speak to a doctor one-on-one at your absolute convenience. So the idea of I must sit in traffic, I must take 4 matatus, one to get to town, from town to wherever, and then back into the CBD, and from the CBD to wherever, that's gone. That's gone as of today. As of today. So even as I take the virtual tour and show you what HealthX is all about, I think I can truthfully say we've gone from a doctor for every Kenyan to a doctor for me. Thank you. And thank you all ever so much.